Taylor, thank you so much for sitting down with me today. I'm so excited to go over peptides and wellness. I know it is something you're super passionate about, and just excited to educate patients on these topics today. Would love to know what inspired you to incorporate peptides into your overall treatment plans.
So I've always been a patient advocate. Just from my medical background, I always educate my patients to make sure they get their annual skin checks, they go in for their preventative wellness checks, and that was always just a recommendation. And now I feel like by incorporating wellness and eventually hormone replacement and other overall wellness services, that I can really be in charge and take the reins on my patients' overall well-being, which will allow them to feel good on the inside, which will reflect more aesthetic beauty on the outside. So it's kind of a full picture for my patients and me.
So for those unfamiliar with peptides, could you dive into what peptides are and how they work in the body?
Sure. So peptides are short chains of amino acids. They're already naturally occurring in our body. Their job is protein synthesis, DNA repair, and by adding and supplementing with peptide therapy, we can allow the body to function more efficiently.
Awesome. So what are the most common peptides used in treatment plans?
I would say big trending peptides right now are the weight loss peptides. I'm sure people have heard about GLP-1s. Those peptides are very popular right now because of their weight loss benefits. Also, NAD+ is a very popular trending right now. It's technically not considered a peptide, it's a coenzyme, but it kind of falls in the peptide category. There's also peptides for muscle building, mental clarity, sleep disturbances, stress. So really most of the concerns that we deal with today on a daily basis.
So Taylor, what does peptide therapy look like in terms of the first appointment and what the patient should expect when they're coming in?
Sure. So typically I will meet with the patient for a consultation. We usually sit down for about 45 minutes to an hour. We go through a thorough consultation that will talk about their goals, any type of troubles that they're experiencing. We talk about their current activity level, their current diet, any supplements or medication, any medical history, and how they sleep, how much stress they're under, their work-life balance. By doing a thorough consultation, I can really get a good picture of the patient's lifestyle. That way I can make recommendations that will be best for them. During that consultation, we also do lab work. This will include basic blood panels, complete blood count, checking fluids, electrolytes, any cholesterol, thyroid levels. We also check vitamin D and hemoglobin A1C. So hemoglobin A1C is the average of their blood sugar over the last 90 days, which really is important for some of our weight loss patients. And that's how we kind of go over a treatment plan of what the next steps will be.
And then in terms of ensuring safety throughout the entire process, what does that look like in terms of follow-up appointments, additional lab work, so on and so forth?
So when the patients come in for their next visit, which is where they'll actually start the peptides, we go through how to draw up the medication, how to administer it safely. We also will meet for most of my patients every 4 weeks, and so that helps to ensure that if there's any side effects, we're going through them. We also use different metrics. We'll get into it a little bit more about the in-body machine and how that works. And that helps to make sure that patients are either losing weight safely or building muscle, or having some of the other benefits of peptides.
So Taylor, tell us how peptides are administered. Could you walk us through the overall process? I know a lot of times patients are like, oh, there's something I have to do at home, and could be a concern. So would love to kind of hear about the ease of just administration.
Sure. So peptides can be taken orally, they can be topically, or the most common route is usually an injection. It's a very small needle. I walk my patients through how to draw up the medication and how to self-administer it. Most patients might feel a little bit nervous, but once they learn how to do it, they really feel confidence. Usually not too challenging.
Okay. Perfect. And then in terms of just tracking, I know that's a big topic. A lot of patients just want to know, what does this overall process look like? So I know you mentioned the M-Body. So could you kind of talk about the importance of this device and how it, again, just helps you as a provider just provide a safe and effective treatment?
Sure. So the in-body is a body metrics measurement machine that helps to measure your body composition. So the three main components are body fat in percentage in pounds, lean muscle mass, and water weight, inter and extracellular. So it really gives you a good full picture. Sometimes patients can be discouraged if they're not seeing the scale move, but really when they come in and see the in-body where they've lost fat and built muscle, that's really empowering and gives patients something to look forward to when they're coming in for their monthly visits.
Awesome. And I know you also mentioned that these are amino acids typically already found in the body. So could we address some of the misconceptions or kind of fears that we hear, just on different social media posts and things like that surrounding peptides, and just how to overcome those misconceptions?
I would say the common misconceptions are usually surrounding the GLP-1s. So a lot of patients may experience nausea or constipation. These side effects are really easy to avoid by making sure that you're having frequent, small, high-protein meals and drinking adequate water, and also fiber intake. So all of my patients will get a detailed care plan about recommendations for protein, water intake, and fiber to help to decrease some of these symptoms. Another misconception is that you'll lose a lot of muscle mass, and that's where we tie back into the in-body and check in monthly with my patients to make sure they're not losing too much muscle and that they're actually gaining muscle.
Awesome. And that is why you are ATA preferred provider. You always make sure things are done the best way, so I love that. And then can you talk about how the peptide regimens are structured for short-term and long-term results? I know you mentioned kind of tapering doses down, so would love to hear your strategy to make sure patients are maintaining results as well.
I would say a lot of patients, we want to think about the long-term results. So when I meet with patients, I usually make a 6 to 12 month treatment plan. Specifically for weight loss, patients usually have a certain goal that they get to, and then we go into a maintenance phase. With most other peptides, those are more long-term use. By cycling on and off of peptides, that keeps the body thinking and changing. A lot of times, just like with any diet or workout routine, you can plateau. So typically we'll do about 12 weeks of a certain peptide blend and then either take a 4-week break and add something else in, or completely switch the regimen.
So beyond weight loss, I know we've spent quite a bit of time on that topic, but would love to learn just some of the other notable benefits that peptides offer.
Sure. So I would say one of the other main peptides that I prescribe for my patients are peptides that help the pituitary stimulate more growth factor. So peptides can treat a wide variety of symptoms. Along with the weight loss, a lot of my patients want to just improve overall body composition, especially if they don't have a specific need for weight loss. Those are growth hormone releasing peptides, and the way that they work is they stimulate your pituitary to produce more growth hormones so you can burn fat easier and build muscle and recover quicker. Patients also typically will treat mental clarity and brain fog, and so that's a common peptide as well. Other common peptides are peptides for libido, peptides for energy, peptides for sleep disturbances, and collagen peptides for skin and hair and beauty.
Nice, okay, perfect. So how do you approach just combining and mixing these peptide treatments to give your patients the best results?
I think combining peptides is the best treatment plan, especially blending them together in the same vial. That way that decreases how many injections or how many different peptides that patients have to take, and it just doubles the benefits. So typically we'll combine, like if a patient has stress issues and sleep issues, those are a good combination together because we know that lack of sleep can cause more stress. That's just one example of how combining peptides can give an overall better outcome.
So as a master injector, I would love to hear your take on Ozempic face. I know that it is a common trending, just overall theme surrounding weight loss peptides, but would love to learn just how you incorporate your injectable treatments to ensure that patients maintain confidence and beauty while they're undergoing peptide treatments.
So I definitely think that Ozempic face is a real thing. I do think that it's compound with how fast you lose weight. My goal for my patients are usually 1 to 3 pounds per week. Typically, most patients are 1 to 2 pounds. I think that helps to decrease the significant decrease in volume in the face, which causes a lot of that Ozempic aging process. Also, I talk up front to my patients about, hey, you're going to lose some fat in your face, which will in turn potentially cause a little bit of an aging process. So we think about maybe being preventative with that and treating with a biostimulator to stimulate collagen, elastin, and keep the skin looking youthful and the face looking young.
Awesome. And then finally, would love to just hear your take on patients seeing licensed healthcare professionals for these treatments. Again, I know there's a lot of quick ways to go about it, but would just love to really dive into your expertise and why that's so important.
I think it's important because first off, you need somebody who's going to be able to manage any symptoms that you have. It's also important to start out with some diagnostic tools like lab work, which you won't be able to get unless you're at a licensed professional's office. Those tools are really important for tracking progress and for safety. You want to make sure that you rule out any underlying conditions and that you're a good candidate and you don't have contraindications for the peptide therapy. So not going through a licensed practitioner could be detrimental to your health overall.
Well, Taylor, thank you so much. It's always a pleasure, and thank you for just educating the patients. I know they appreciate it every time that you are available for the platform, so thank you.
Thank you for having me.